Good afternoon. Thanks for joining us tonight. My name is Brother Dr. Robert Carter. I serve as the Deputy Surgeon General for International Health and Travel. Tonight, we'll have a dialogue. I think that many of us will appreciate and reflect on as we enjoy our summer travel, both here in the United States and maybe to foreign destination, as the pandemic has bared down on us for many years, and so many folks are getting out, making up for their travel. So tonight I will have a dialogue. So this will be a little bit a breakaway from our traditional panel, and tonight I have an opportunity to have a dialogue with one of our other Surgeon Generals, Dr. Victor Narcisse. So Dr. Narcisse and I will hopefully help inform you on ways to basically keep yourself safe, protect your families during your travel. Specifically, we would like to discuss ways that will enhance the likelihood of you being prepared from a medical perspective during your pre-travel. So what do you need to take with you as you travel? And then during travel, often when we're at home, we have a medicine cabinet, we have supplies in the home that if we have an emergency, the kids, or our visitor, we have tools that allows us to be able to respond to that. So we'll talk about during travel, what are things you need to take with you, and then also how do you return home safely. So it's critical never to underestimate the importance of having a solid first aid travel kit. In fact, it's probably one of the first things that you used to pack. Why is that? Because recent surveys have actually demonstrated that 80% of Americans are not equipped to deal with minor travel emergencies. So things that happen outside of the home. When you're out on the road, traveling in the United States, visiting family, loved ones, specifically when you're in a rural, remote area, specifically like visiting undeveloped countries or developing countries. So that really leads to thousands of unnecessary emergency visits and to hospitals and family doctors for relatively minor, simple things that you could treat, such as a blister, small things that really, if you were prepared, you could actually treat. What's worse is that if you have one of these small medical emergencies and you're away in a rural area or an area that's not as developed, just finding a doctor or finding these basic supplies can be a daunting task and can ruin your vacation, frankly. So you don't have to be a doctor to help yourself or help others, specifically through these minor emergencies. What it just requires some simple tools and simple skills that you can render aid and help somebody during your travel. So whether you're hiking in the Rocky Mountains or shopping downtown Paris or New York City for a day, there are critical things or key things that you can basically have with you that will help you prepare yourself to meet potential problems abroad or in the homeland. So also, specifically when you're traveling overseas, and I'll mention this up front just in case people are not on for a long time and they have to depart, but there's an opportunity, especially when you're traveling overseas, that you can register with the U.S. State Department. It's called the Smart Travel Enrollment Program, STEP. And what they can actually do is when you're registered in the STEP program and you're outside the country and something happens, you actually have a contact. You have someone you can actually reach out and touch that's there in that country. And they're there to actually help Americans that are traveling abroad that may need something. And critically important is that natural disasters happen, civil unrest can happen, and family emergencies happen. So sometimes family members may need to be able to get in contact with their loved ones while they're on a trip. By registering, this allows an actual conduit basically for you to protect yourself and as well as for family members to be able to contact you in the case that you find yourself in one of these unfortunate situations. So we're going to spend some time tonight talking about your first aid kit. We'll talk about what vaccines you might need. and we'll talk a little bit about specific vaccines for certain locations. So I would like to turn it over to my other co-panel member, Dr. Victor Narcisse. And I would like Dr. Narcisse, before we get started too far into this dialogue, if you could talk a little bit about what vaccines should one actually take, and how do you prepare and understand vaccination requirements. So if you could just talk a little bit about traveling and vaccine requirements. We've heard a lot about COVID and vaccines, but there are a lot of other vaccines beyond that.
Sure. Thank you so much. My name is Brother Victor Narcisse. I am a internal medicine physician. I practice in Houston, Texas at the Houston Methodist Hospital and hospital medicine, and I'm board certified in internal medicine and geriatric medicine. And I come to you as one of the deputies from the Surgeon General Initiative to talk about travel. Vaccinations has been something that has become a buzzword and something that has become almost part of our lives at a much different level because of the COVID pandemic. But there have been a number of vaccinations that have been required for a whole host of locales. It obviously is location specific. So you can't just say, well, I'm just going to get a list of things that's going to be good for everywhere. If you're going to sub-Saharan Africa versus Southeast Asia versus Central America, there will be a different set of vaccinations that's necessary. So the place that you can access for that information is really the Center for Disease Control. They have very good information on their website that will say you're going to such and such part of such and such country. Here's what you need, whether it's yellow fever or whatnot. They also have a lot of other good information in terms of notifying people of health emergencies there, health issues that are specific to the location, and certain packing lists. So it's a great place to start your planning process. If you haven't been there to that website before, this is a great time. And you really need to look at the vaccine requirements far, far, far in advance, because a number of vaccinations may require a series of doses. And in some cases, you're not allowed to travel unless you can provide proof that you've completed the series. So I really encourage you to take some time at far in advance of your travel dates. The World Health Organization is really the other resource that keeps up-to-date list of vaccination requirements, specifically who will need yellow fever vaccinations. That's really one of the keys. Now, COVID-19 vaccinations have been more recently required for travel in certain locations, certain countries required for entry. If you're inside of countries to access services, you may need to demonstrate your COVID vaccination records. And in many places will require a COVID PCR test within 72 hours of arrival. So you do need to be mindful of that and budget time in case your test comes back positive.
Yeah, Brother Narcisse, thanks for that. I was just thinking, I recently traveled to Phoenix, and I'm fully vaccinated, and I would imagine a number of folks on the flight were fully vaccinated. But sometimes people, now that they're vaccinated against COVID, they may begin to feel a little bit sick, but they don't test positive for COVID-19 or the flu. Should they still travel? And what are some risks, for traveling when you're not feeling well? Could you still have COVID, or what are ways that we can reduce potential spread of infection?
Well, there's a whole host of respiratory infections that can be spread through droplet or airborne mechanisms. And so if you're feeling ill, you really need to reevaluate whether or not it's safe for you to travel. It's possible that you might need to even postpone travel. In many communities, folks are encouraged to test specifically for COVID, but in some cases, if the COVID test is negative, to check for other respiratory viruses before you get on an airplane. Now, airplane cabin air has been something that a lot of people have talked about. Is that safe? You're in a small confined space with other people for long periods of time. I still think that it's best to continue to wear masks, although many people in today's as of today's broadcast are not masking any longer, whether they're vaccinated or not. Still, because the air is exchanged very frequently on an airplane cabin, it's one of the safer places because the air just doesn't linger. But the air is such that you'll have the same kinds of risks if you were in other places and other locations with other people that are nearby, particularly buses, trains, and other forms of transportation. So when you travel, we think of airplanes first, but even if you're going to travel, whether you're traveling locally or internationally, it's very common for individuals to travel through mass transit mechanisms wherever you arrive in your destinations. And so as a result, if you're coughing or sneezing, or if you have a sore throat, or other people are doing that, you can contaminate. They can contaminate surfaces and spread infection to other people. And it's great that Brother Carter, that you're vaccinated. I'm vaccinated. Everyone that I know is fully vaccinated in my immediate network. But it's very common to encounter individuals who are immunosuppressed or have other medical problems that don't allow them to be fully protected against COVID-19 or other infections. So it's really important. You're not doing these things for yourself. You're doing it for them. One of the things that really comes up is, what kinds of things should you bring with you when you travel? What should you put in your medical kit?
Yes, no, that is a great question, and as I was thinking about, as you were describing these travel scenarios, one of the things I think that has recently occurred that maybe didn't always occur in the past is, people think, okay, I'm gonna take a trip for the weekend. I'll be back home on Sunday, and so they take enough medication, basically for what they think is going to be a short-term trip. And what you hear increasingly are individuals that may develop a respiratory illness, may test positive for COVID, and they're stuck. They have enough medication for, again, the weekend, but they have not really prepared that they may be there longer. So when traveling, the first thing you should think about is, okay, I may get stuck. So what you should do is coordinate, and it's increasing recommended that you coordinate with your physician, insurance companies to ensure that you have enough medicine for resupply for on the road. And so what you can do is work with your physician and compile a list of prescription medication. And if you're traveling outside of the country, in a generic form, and that will allow, just in case, if you're traveling outside of the country or even away from home, that you can actually get medication. Because again, if you're in a situation where you're outside of your network, it may delay your ability to actually get medication. In particular, if you're stuck in a hotel on COVID positive and really can't get outside of that. And so, some of the things you should be asking yourself is, what might I need if I get an upset stomach? Think about things that have happened, maybe frequently to you, and things that have happened to you maybe on the road. So you think about your immediate medication, and then you begin to think about what other medication might I need in the case that some of these unexpected things actually happen while I'm out there. So brother Narcisse, as a physician, I would definitely like to understand what specific guidance do you provide to your patients regarding the maintenance and treatment of chronic diseases, in particular if they're going to be out of town for some period of time. Any thoughts on how people can reduce the risk of medical emergencies, in particular around not having their medication?
Sure. There's a number of things you can do. The first thing that we always encourage everyone to have is a list of all the medications. It just doesn't have to be typed in the prettiest of font. It could be handwritten, but a list on on a card or a sheet of paper. That way you can easily refer. You can show any health professionals that you might encounter or might need to encounter over the course of your travels. Additionally, you mentioned the actual medications. It's very common for folks to get a 30-day supply, but in some cases, many prescription plans will prefer a 90-day supply. And depending on where you are in your cycle of your medication refills, you actually may need to communicate with your doctor to have it called or a new prescription provided. This is very important because certain medications require additional regulatory support to write for the medications, pain medications, other controlled substances. In many cases, your physician can't just call a pharmacy in another city, another state, much less another country, and that medication order get fulfilled. And then, of course, every country is going to have different rules around which medications require certain attention, special regulations, special permissions. And so you really need to understand that in advance. We encourage people to actually physically have the medications in hand, so that if you know that you're going to travel for 2 weeks, if you have 30 days worth of your medications, it gives you a buffer to allow for any delays, any quarantine that might come about. So your physician needs to be involved with your planning process. They may need to send medication to a specific pharmacy, but I have a license in a given state. I may not have a license to practice in a different state, or certainly not in a different country. So again, you may not be able to call my office from Cancun, Mexico, and expect for me to call a pharmacy in Cancun, and then you get all the medication you need, potentially. Additionally, you should have a list of your family contacts. Sometimes people will run out of their medications, and one of the things that a workaround we've had to do on occasion is to have medications filled local to where the patient started, and then have the medications physically shipped through one of the express shippers to another location. That's not ideal. It's fraught with hazard, but sometimes that happens. Then, of course, there are disease-specific things. Do you travel with oxygen? Do you require access to hemodialysis? If you're traveling, what kind of mobility requirements do you have? You might be fine at home, but if you're going to travel travel along the Champs-Élysées in Paris, you may need additional mobility support than what you're accustomed to utilizing at home. So you may need to prepare for that. And a number of my patients have mobility issues. And so those are some of the things that we see all the time. So involve your clinicians, involve them early in the planning process, so that if any medications need to be staged or positioned around the country or around the world, that can be done as expeditiously as possible. I wanted to ask you, what other thoughts you have on reducing medical emergencies?
Yeah, that's a great question. I've traveled quite a bit internationally, and have encountered individuals that have faced emergency scenarios where they had to be evacuated back to whether the United States or their home country. And so the question often arises, should I purchase travel insurance? Well, what are the risks of not having travel insurance? And the bottom line is that insurance is there for a reason, and it's something that you typically, like most insurance, you never expect to utilize. But travel insurance is one of those that you probably will never have to utilize. It's relatively inexpensive, but if you find yourself stranded in a country with a medical emergency, it can cost hundreds of thousands of dollars to actually get you back to your home country, where you may need more definitive care than what's available in the nation that you're visiting, let alone they may not necessarily have the same standard of care and options for you. And often you may require medical stabilization in order to be able to be transported. So often when we're traveling, in groups like a tour group or for work, you may already have traveler's insurance. It's something that you really need to look at, and specifically insurance for medical evacuation, because some insurances will provide some services, but specifically that medevac insurance, which is obviously can be quite expensive, specifically from rural destinations. And in addition to your health coverage, travel insurance may also cover other things as well. Some of the financial burdens of actually having to leave. So a good travel insurance package, will support you and also allow you to actually be able to have peace of mind and ease that if something happens to you while you're traveling outside of the country, that you can enjoy that experience. And unfortunately, the unfortunate likelihood if something actually happens, you have a way of basically getting evacuated back. And if you earlier, I recall, if you recall, I talked a little bit about the STEP program, so which is registering with the U.S. Embassy or within that country. So the combination of basically the U.S. Embassy knowing that you're in the country, plus having travel insurance, if something happens, it's highly likely that you will be able to receive the definitive care that you need. Also, the embassy will generally have a list of hospitals in the areas, one that they would recommend. And so just that overall, you spent a lot of money. You often spend a lot of money on vacations, but sometimes those small things can be quite disruptive. And as I mentioned earlier, one of the things that unfortunately happens now, individuals, different countries, as Dr. Narcisse mentioned, have different criteria, entrance and exit criteria for whether coming in the country, vaccination requirements, or basically once you enter in the country, many of them are actually doing random screening now for COVID. If you happen to test positive for COVID, sometimes there's quarantine requirements. So if you plan to stay at that destination for a weekend or a shorter period of time, now you're stuck for 10 days. That has some added expense. There are also travel insurance now that's available that will allow you to basically, if you find yourself in that situation, you can maybe tap into some of those resources. So with COVID, I think it's brought a lot of attention on basically how do you make a risk-informed decision? How do you manage the overall risk of actually traveling from a health perspective, but also just from an overall perspective to include your time and resources. So one of the things that often is talked about, and we heard a little bit about that more during the pandemic. In fact, we heard a lot of conditions more during the pandemic. But one of the things that comes up periodically is health considerations when flying. And so I would like to ask Dr. Narcisse a little bit about, if you could just share a little bit about how does high altitude affect travelers, and any thoughts on how high altitude affect chronic diseases and how people may mitigate these. So, should people with chronic disease, instead of taking a 16-hour flight, to Tokyo, should they break it up into 2 flights? And just any thoughts on that?
Sure. Thank you, Dr. Carter. We definitely understand that there's lower pressures of oxygen, less oxygen available at higher altitude. And high altitude is really like 8,000 feet. Many planes will fly in sort of a 30,000 foot space. But aircraft cabins will pressurize, and most of the time, most commercial airlines will pressurize to something close to 2,000, 4,000 feet. So the high altitude sickness that you can get when you're hiking in the mountains is something that you won't see on an airplane, but you might need additional oxygen, particularly if you're vulnerable. Who's going to be vulnerable? Someone who's got a problem with their lungs, problem with their heart. And again, there are a number of folks who will be able to get by at sea level, but at the 2,000, 4,000 feet struggle, and at the 8,000 foot level really have more difficulty. So that also makes a difference, because you might need to fly with oxygen when you're not accustomed to using it. And if you're flying into a high altitude destination, the Rockies would be a great example, but any high altitude locale around the world, you need to be mindful of altitude sickness. But any heart lung problems can get you into trouble. And so one of the things we always try to do is, how do you avoid getting into more trouble? One of the things that we worry about for everyone is that the individuals who are sitting for long periods of time, like you might on an airplane, are susceptible to developing blood clots that can start in the legs, travel upwards towards the lung. If you get a blood clot in the lung, we call that a pulmonary embolism, and that can potentially be very dangerous or fatal. And so there's simple things that you can do. If you ever listen to the full safety briefing on an airplane, very few people do. They actually will have on the printed card recommendations of some motion exercises you can do with your legs or potentially your arms, getting up and walking when that's allowable on the airplane, because that will reduce your risk of blood clots. Again, if you've got heart or lung disease, you really need to plan with your pulmonologist, your lung doctor, your cardiologist, your primary care doctors to determine what your needs might be. And there are a couple other things that I think are generically useful for folks. What's your emergency plan? If you're going to travel to a place that's going to be at similar risk, then it's going to be the same as being at home. But whenever we travel, the situation is very different than we're accustomed to, whether it's the altitude or wilderness or just a foreign country where people speak a different language. One of the things that sometimes gets lost, because we're so accustomed to doing everything in English, if you're traveling to a place where the healthcare community doesn't really communicate in English, you may experience a problem, and they may not be able to adequately articulate your problem to the healthcare apparatus. So, translation support might need to be part of your emergency plan. Who are you going to contact? The embassy, I think, is a great place to start. Having written lists of here's who I'm traveling with. Here's how you contact them. Here's where I'm staying. If I get into trouble and I can't communicate, I can't verbalize, here's where you can find the other people in my party who might know what's going on with me. You might need to travel with a buddy. It's a great idea if you're traveling with others that they know a little bit about you, about your health background. So in case someone needs to speak on your behalf, they can do that. And then you're going to need to start thinking about where you're going and what healthcare resources you might need. If you're going around the corner, you might need just hand sanitizer and some wipes. But if you're going into the backcountry, into the wilderness, you need to pack a first aid kit that would look very different than if you're traveling to a major metropolitan area where people speak English and you have access to tertiary care just like we would have in the United States. But part of your emergency plan needs to be what first aid kits would you bring with you, supplies, where can you access urgent care, emergency rooms, hospitals, and we talked about medevacs. So Dr. Carter, could you speak to what you might think about bringing on an international flight for your first aid kit?
Yeah, no, I really appreciate that and incredible information that you just provided, and I'll just piggyback on that. Generally, if you're on an international flight, the first aid kit and supplies are adequate to respond to most in-flight emergencies. If it's something that if it's a potential life-threatening in-flight emergency, it may require the actual airplane to land. And if you've ever been on a flight, especially an international flight, and there's some type of emergency, often they will come over the intercom and say, ask if there's any healthcare providers, anybody with medical expertise on the flight. If you're fortunate and you're having a medical emergency and you have a healthcare provider, that may actually help mitigate the situation. But obviously, they're limited by the supplies that they actually have. So it's important for you basically to first of all understand. We talked a little bit about, and we'll talk more about this, about what you have in your first aid kit that you're bringing with you. And so one of the things you got to definitely be aware of, be cognizant of, is what things you actually bring onto the plane and what things maybe you actually put into into your checked luggage, because there may be things that that are not allowed actually on the flight that you might want to bring with you. So this may require you to actually take, a go first aid kit, something that you actually have on the with you on the airplane, and in particular, like your medications, things that you're going to need immediately, and especially in the case that maybe your luggage is lost. So you want to make sure, and we talked about your first aid kit and kind of your expanded medical cabinet. So you want to make sure that you have what you need until you arrive at that destination, and maybe a few days beyond that. In particular, if your baggage is lost or stolen or damaged along the way. And as I described before, there may be things that you may need specifically for you. So if you're a diabetic, you may require needles for injection. So are other things that may not necessarily be something that everybody's required to have, but you may need those unique supplies within your first aid kit, within your medical go bag. So it's important for you to basically understand what's in the bag and what things you need to actually check into the checked in luggage. But it's critical again for you to evaluate that. And also, if you have any questions, you can always reach out to the airline, ask them questions. It's better to inquire about what things you can bring and what things that you can't bring. So just if you have questions, definitely reach out to the airlines to ensure that that you feel comfortable and safe along that journey. So again, we'll circle a little bit back to sort of like something that people may not always think about. Dr. Narcisse talked about this a little bit, where he talked about looking at the CDC website for things like yellow fever, but there may be other vaccinations that you may have completed that may be of value, specifically during a medical emergency, or if you decide maybe you're at a destination, you say, hey, I want to maybe do a safari, I want to do something else, and they maybe have specific requirements. Dr. Narcisse talked about there's a difference being in an actual urban area versus actually going out to the back 40. So, Dr. Narcisse, I would like if you could speak a little bit about should people take their immunization records with them during international travel, and what does that mean? I mean, how could that make a difference in their overall trip if they find themselves in a situation where they need additional immunizations while they're in country?
Yeah, absolutely. And today it's so easy to bring this data with you, whether digitally or if you're going to have a paper copy. It's the kind of thing that you should secure at the level of your passport. You should always have it with you, because if you're in the wrong country and they require vaccinations for as a condition of entry, you may end up receiving or needing to receive another vaccination from a place that is less hygienic than the one that you would have gotten back home. And so if you want to avoid emergency requirements for your medications, it's better to plan ahead and keep those records. And today you should probably have access to all of your immunization records digitally. But again, if you elect to have it on a paper copy, you should keep it with your passport. I really wondered, if we get into a little bit more of the specifics of some of the things that you might put into your individual first aid kit when you travel.
Yeah. I mean, so this is probably the moment, given the topic that many people are waiting for is, and again, personally, my first aid kit, the items that I put in my personal first aid kit has evolved over time. And some of it, unfortunately, was trial by error. It's like, wow, I really wish I had X. and then you try and find X, and it's difficult at times, in particular during a pandemic. And it's something simple as a thermometer. I remember, during the pandemic, there were periods of time when you just could not find something simple as a pulse oximeter or a thermometer. So no emergency travel kit is complete without some basic things. And so it's things that people probably are more familiar with now, and they typically would keep those things excuse me, with them more now than they have in the past. But things like antibacterial wipes, if you're traveling, you want to make sure you have enough of a supply, like I said, in your go bag, but also to support you throughout the duration of your trip, because you may not be able to find those things at your destination. Hand sanitizer is probably one of the most popular items now. Historically, people, would look at you weird if you pull out hand sanitizer, but now hand sanitizer has become something that most people actually keep with them. Instant cold pack. I can't tell you a number of times I've traveled and was able to basically, give somebody, cold pack, for a minor scrape, bruise. Pain reliever. Again, it's something you want to make sure that whatever pain relievers you're actually bringing are with you are okay with that country, meaning that if you're transporting painkillers that are maybe on a narcotic list and you have a certain amount, you just want to be careful. But things like that are more common, that's sold over the counter, you probably will be okay. But you definitely want to have some and have enough of them that you have with you, but also that's safe. And also traveling, we're used to a pretty high standard here in the United States, but I traveled to a few countries that had a problem where there was counterfeit medication. So I ran out of malaria medication and bought some locally, and I became really ill. I'm pretty confident now, after reflecting back on that the medication may have been contaminated, so I definitely recommend whatever medication you have in your emergency first aid kit you actually bring with you. Something simple as like a pair of scissors. Now that may be something that you put into the check bag as opposed to bringing onto the flight with you, but a pair of scissors, things like tweezers, so that may be another thing that you may want to actually put in the actual check luggage, as opposed to losing your precious scissors and tweezers at the TSA check-in. You may want to put some of those things, but those are things that you may want to actually have with you. They're just some basic things that I think will actually help you. I would like, again, and Dr. Narcisse, I would like kind of your perspective on, what else would you, recommend folks include in there? Maybe medication for upset stomach. What else would you recommend travelers add to their first aid kit?
Well, the most important piece is actually knowledge. And so there are a couple of things that I would encourage everyone to do in general. And it may become more important in an emergency situation while you're traveling. So things like learning CPR. I think everyone should know how to perform CPR. And some communities have ready access to life-saving resuscitation, and other places may not. Or if you're traveling in a place where the nearest healthcare resources might be some time away, the ability to provide effective CPR could be life-saving for someone. Similarly, a basic first aid kit, a first aid course, and there are lots of places to pick up this information, whether it's the local Red Cross or a community college. I think that those are great places. I wear glasses, and having a backup strategy for what to do if I misplace my glasses is something that's more than an inconvenience on my travel with the strength of my own prescriptions. So I think that for many people, having access to contact lenses or a backup pair is something that is quite important. We've talked about face masks and potentially even face shields when you're traveling. we talked a little bit about a number of fluids that might be useful to carry, like hand sanitizer. Remember that in some places, some airlines, some countries have restrictions on how much of that you can carry. In the United States, it's often less than 3 ounces. Other places may have different rules. Make sure you understand what those rules are. Make sure that you understand specifically the laws of the places where you're going. Otherwise, you're at the Moscow airport with something that might be acceptable in many states in the United States, in the US, but not acceptable in other countries. If you're going out, again, further away from healthcare resources, you might need deeper and deeper skill sets and equipment. Things like the ability to provide a tourniquet is something that would be life-saving if there's a major injury or a cut. In some cases, the ability to apply a chest seal might even be necessary if you've got a significant trauma to the thorax. You might need to think about communication devices. If something happens where you are, how would you let someone know that you're in trouble? Cell phones might work in many major metropolitan areas, but it doesn't take very far, even in my home states of Texas and Louisiana, where the cell phone signals are ineffective to communicate. So you might need some alternative mechanisms to seek emergency assistance. So emergency radio, CB radio, a number of things that might be the case. There are also some more advanced things that you might need to plan with your physician. Some of the easy ones would be antacids. There are a number of countries where you might get some indigestion if you eat the wrong kinds of food that you're not accustomed to. Many countries, many locales have higher rates of infectious diarrhea. So an anti-diarrheal therapy that has bismuth, the stuff that makes the medication pink, for example, might be important. You might need anti-diarrheal medicines, a medication that would stop you from having diarrhea, and a number of pill formulations of that that are available over the counter in the U.S. They may or may not be over the counter in other locations, so you might need to bring some of that with you. I less commonly see people get in trouble with constipation where they need laxatives and stool softeners, but that's something that can be the case. Many people travel and need to bring motion sickness medications because of the airplane or the cruise ship, or you're traveling long distances on a bumpy bus that you're not accustomed to. So those are things that might be important. There are a couple others that again need medications that might need prescriptions in the United States. If you're going to certain places where the risks of infection are very, very high, your physician may be comfortable providing you a prescription and for you to bring antibiotics with you. Similarly, steroids or antihistamines might be important if you have a risk for allergic reactions. Many people in backcountry kinds of environments might benefit from Tylenol or acetaminophen or non-steroidal anti-inflammatory drugs like ibuprofen kinds of medications. Those pain medications are often acceptable in many places and can be very, very important. Additionally, whenever you're traveling, we talked about the infectious diarrhea. Making sure that you have a plan to access the safest food and water that you can is something that might make the difference between your enjoying the entirety of your trip and your finding parts of your trip, maybe much of your trip, absolutely miserable because you're feeling quite ill. We talked about a lot of different things. Dr. Carter, have you ever set up a checklist to prepare for these kinds of things with so many things in your head?
Yes, and I'm glad you mentioned that, and you talked a lot about knowledge and basically how knowing knowledge is one of the most important things in preparing for a trip. And so yes, a checklist, it can really save you a lot of time. And we talked about tonight various elements of that checklist. And again, being in the military, we function off of being prepared and having checklists. And so one of the important things is really for you to identify what critical documents you might need, not just your medical documents, but copies of your passport, your travel documents, copies of your prescriptions, and you talked a bit about this already. The prescription for maybe your glasses, other medical supplies. So met a gentleman actually on a flight. He forgot his CPAP for sleep apnea, left it on the airplane. Had severe sleep apnea. In fact, he was on vacation for 14 days and didn't actually have the prescription for it. So he probably, fortunately, he was in a country where he could have acquired a CPAP with the prescription and an explanation of what happened. That may have been an easy, durable medical device to actually get a replacement. But again, by not having that prescription, not having the settings of his CPAP and everything, really put him in a difficult position. So that may be one that is, again, durable medical equipment, oxygen, things that you may not necessarily need all the time, but if you find yourself in a situation, it may be of value. But again, CPAP, sleep apnea, is increasingly common, and I'm sure there's countless number of folks that have actually left their CPAP in a hotel as they're transitioning from one hotel to another, or on an airplane. So having that documentation would be of value. Your health insurance card, documents, numbers specifically if you need to exercise your travel insurance while you're away. Dr. Narcisse already talked about the proof of yellow fever, vaccination, and your other immunizations that may be required. Healthcare providers at home, just in case you actually need to get a healthcare provider where you're on travel to in contact with your provider. That may be to explain your health condition, translate or provide a specific medication, and also information about the embassy. We talked about consulate, but really, and again, the more you travel, the more likely you are to continue to create your own checklist. And often we create checklists as a result of something that tragically happened, where we forgot to do something. So what I recommend is preemptively create yourself a checklist, look out on the internet, listen to what we're talking about, and say, what can I learn? And ultimately, again, it's about preventing something happening that creates an unpleasant experience during your vacation. One of these I would like you to talk on, Dr. Narcisse. If you could talk a little bit about medication safety from a safety perspective, and again, if folks have to actually resupply their medical get medication, what are some things they should think about in ensuring that they have this a safe handshake of medications they received in the U.S. and what are some ways that they can at least improve the likelihood that they don't end up like me getting some medication that may have been adulterated or altered in a way that wasn't consistent with the original formulation?
We talked about having a list and sort of paying attention to what's on that list. So you're actually taking the medications the way that the dosing instructions were originally set up is so critical. Old medications, expired medications, it's something that is very important to pay attention to. My grandmother had a stash of food, water, and materials from her duck and cover kinds of recommendations when everyone had a bomb shelter in the 50s. So when we visited her home years later, sometimes we'd access that cache and we'd find things that were, very, very far expired. And it's something that could potentially be dangerous if you took medications that were expired for quite some time. Many people have assembled materials since the pandemic. Well, now we're getting to the place where some of that material may have become expired while you had it in storage. So do be mindful of that and throw out things that are expired. Some people will try to take things that are expired. It's probably not worth the risk. It's probably easier just to toss it in and just get another supply of these things. We talked a little bit about keeping the prescriptions in the original packaging, in the original bottles. That can be quite helpful. It has the name, the instructions, sometimes coding information that will be important to regulatory or law enforcement agencies. We talked about a list, making sure it speaks to the brand and generic. In some countries, they have access to the medications, but it's under a different generic name. It's not the same brand, and then it has to be translated. So if you have the list, I can't tell you how many times people have traveled to the United States from other countries, and I'd had to have assistance with the translations, and I kind of have to, okay, that's probably this medication, and we try to figure it out. We spoke about the controlled substances, particularly narcotics, needles, explanations. Medications are often kept in child-safe packaging. Maintenance of that child safety is potentially helpful, particularly medications that look innocuous, that have pretty colors, like cough medications, cough syrups. They can potentially be very, very dangerous to little ones. And so make sure that as you assemble your first aid kit, you've got things that will work for adults. You might need a different strength, even of the same medication, to account for children. Many of the medications for children are actually dosed by weight. And so understanding with your family's healthcare advisors, your pediatricians, your family practice clinicians, you might need to have that acetaminophen in adult strength and in children's strength. You might even need, if you've got several different kids or different ages, different weights, you might need adult, a teenage kid, and then an infant or a child. So you need to be mindful of that.
Again, wow, really, really important information and things people basically think about as they're preparing for their travel. Interesting enough, often some new disease or virus or something scary will appear in the media, and people get nervous. Obviously, now with COVID, we, in the past we've heard about the bird flu or swine flu or something of that nature. One thing I wanted to definitely take a little bit of time and talk about tonight, would like your perspective on, is we're hearing a lot in the media recently about this new virus called monkeypox. And so folks that may be considering travel, it's just quite scary sounding. But if you could just share a little bit about, what is monkeypox, and is that something that, folks should be worried about? And again, as a physician, how do you talk with your patients, about when they, maybe come in with, something that's hot in the media that they're really concerned about? How do you advise them?
Thanks, Dr. Carter. Monkeypox is a rare disease. You can imagine that it comes from the monkeypox virus. And this is something that we see in Central West Africa, really tropical locations, tropical rainforests. And so the more time you're spending in an environment like that, the more exposure you potentially have. But in the United States, there are more than 1,000 cases as we do this broadcast. And so it's something that has traveled, and it's something that will continue to gather attention. People who are infected with monkeypox virus usually get it through contact in the skin, bodily fluids. Again, those bodily fluids would have the infection from animals. The animals could be alive or dead animals, from humans, respiratory droplets, contact with contaminated materials. Any of these are possible. And monkeypox is dangerous. It can be fatal. Some people think as infrequently as 1%, maybe as high as 10, 11%. And so it's a significant issue. If you've had your routine vaccinations, including smallpox, that might provide some protection. It's not 100% clear. What kind of symptoms might you have? Fever would be the thing that would most people would see most commonly. Headaches, muscle aches, swollen lymph nodes, like you've had the flu or mono, might be the kinds of symptoms that one might expect. You might get lesions at different parts of your body at different times. They may evolve. They may come together. You may develop rashes like macules, papules, vesicles, scabs, and that's sort of where, just like with smallpox, where the disease kind of gets its name, that these characteristic skin lesions. So overall, how worried should you be? You should be vigilant because the risk of the general public is low. But if you're having new problems that aren't explained, particularly these rashes, it's something you might need to seek healthcare for. You don't have to have all the symptoms, the fevers or chills and everything else. But if you do find yourself in the situation, you should probably self-quarantine, just like you did with COVID. So I think everyone knows how to do that now. You might need to, if you're going to get healthcare, you might need to alert them in advance so they can prepare their quarantine mechanisms. And again, everyone has become very, very familiar with this, but as COVID has become something that we're living with more commonly and is reaching essentially endemic state, people aren't quite as vigilant. When I first saw my first COVID patient, they'd just come off of a plane from Southeast Asia. I mean, the amount of time people spent preparing their equipment was significant, and now no one spends as much time with that. So with monkeypox, give your healthcare providers an opportunity to prepare. Particularly if you know that you've had in contact with someone who's monkeypox, particularly if you've been in places or been around people who've been in Central West Africa, who've had high-risk personal behaviors, including blood transfusions, sexual contact with individuals who are in high-risk communities. So if you're sick, you think you might have COVID or a respiratory infection or monkeypox or whatever it might be, maybe you need to delay your trip. I know that everyone is so anxious to travel, has booked travel far in advance in many cases, had significant burdens in trying to obtain the travel, but it's not worth getting yourself sick or other people sick. Take some time, build in some extra buffer in your schedule, make sure you have travel insurance so that you can pivot if you need to.
Yeah, I really appreciate that. Again, I wanted to use that as an example. We often will hear information, will in the news media about some strange sounding virus or bacteria that's going around, brain eating amoeba, or something alike. And I really appreciate that, and wanted to just share, with people, that with the audience, that it's important to actually know where to receive information that you can trust. And so the Centers for Disease Control, CDC, actually maintains a repository of information that is vetted, based in science, based in clinical outcomes, information that you can actually utilize, and as opposed to relying on information that's floating around the internet that that may not necessarily be scientifically, are based in scientific evidence or clinical evidence. So you can always, again, go to the CDC website, WHO, the World Health Organization, are some really great places to get information that you can believe in, that will help you throughout your travel and just in everyday life. Dr. Narcisse, we're getting close to the end of the session, but I just wanted to give you some time to share any final thoughts, anything that you would like to leave folks with, as they go out and engage in travel, this summer. Just some final thoughts on what they can do to keep themselves safe.
Sure. You talked a significant amount of time about proper planning prevents poor performance, and so understanding your health circumstance, your health risk, in your own person, your family, where you're going is key. Coordinating with your healthcare providers is something that I think should be mandatory for everyone. Travel medicine, your primary care providers, I think, is a key piece. Learning and educating yourself for yourself about the risks. The CDC website, again, is not going to provide you the individual information, but will give you generic ones, and then you can tailor that with your own healthcare providers. And so I think that if you do that, pack well, be thoughtful about where you're going, be understanding of what resources you might encounter, and what the threat matrix might look like where you're going. That will guide your thinking about what you need to bring. And it's often the small thing that you've forgotten that you need the most, and it will make the biggest impact on your travel. So make sure that you're paying attention. Pay attention to simple things. Be careful where you're traveling when you're overseas, in cars and buses. Be careful what you're drinking. There have been a number of episodes where individuals have been in a resort and they've had probably something to eat or drink that made them very, very sick. So make sure that you're in a trusted location, and it's often very tempting to travel the way that individuals in the community consume what the individuals in the community eat and drink, but your immune system may not be adequately prepared for the threats that someone who lives in that environment may have all the time. So be mindful of that. Be mindful of your mosquito and bug spray, making sure that you understand if you're getting a tick bite, what do you do? Making sure you're consuming safe foods, that you're avoiding sunburns, you're avoiding injury in vehicles. We can go on and on and on. But I think that the big piece is travel with your brain, travel with your experience. And if there are places where getting additional experience, additional opportunities might make a difference for your trip, for your travel, for your experience, it may not be a bad idea to do some safe internet searching, read a great book about the topic, and get some training on particularly CPR, on first aid. Those are great things to do.
Again, really appreciate that, and you're spot on. Planning, doing wise, safe things during your trip. All of those will really guarantee that you will have an enjoyable experience. And so, really appreciated the discussion, the dialogue tonight. And again, it's not that we're discouraging people from traveling, but it's that, with everything, it's really about traveling safely, being prepared, being one step ahead of a potential medical emergency or some type of tragic event. And so I hope that the information that we talked about tonight will help prepare you to have a safe trip, whether you're traveling internationally or you're traveling domestically, because there are rural areas, Grand Canyon, Death Valley, areas that are really exciting to visit, but people find themselves here in the United States in situations where they were not prepared for a mudslide or some storm, or maybe someone having an actual broken leg or getting injured in a remote area while they're attempting to explore the wilderness. So again, Dr. Narcisse, thanks a ton. Thanks everybody that joined us tonight for this webinar, for the webinar series. And if you like the video, please subscribe. We really appreciate it. This is an effort where we're really attempting to provide useful information to help individuals stay safe and be able to take care of themselves in a better way when faced with either emergency or chronic situations that impact their health and well-being. Thank you. Have a great night.